All women have 2 ovaries which release an egg alternately every month. These ovaries also produce female hormones that are responsible for many things like fertility, period schedule, facial hair, etc. Apart from 3, they also produce androgens or male hormones but in very minute quantities. Polycystic ovarian syndrome (PCOS) is an endocrine disorder that affects approximately 5% of all women, which are very commonly found in day-to-day routine practice. Polycystic ovary syndrome, also known as Stein-Leventhal syndrome, is a hormonal disorder common among women of reproductive age that is characterized by an elevated level of male hormones, androgens, and infrequent or absent ovulation and ovulation. Most women with PCOS grow a number of small cysts, or fluid-filled sacs follicles, on their ovaries and fail to regularly release eggs. The cysts are not harmful, but they can lead to an imbalance in hormone levels. PCOD vs. PCOS, are they the same? Many women use both PCOD polycystic ovarian disease and PCOS polycystic ovarian syndrome interchangeably when both are very different conditions. While both the conditions are related to the ovaries and both cause hormonal disturbances, there are many significant differences. What is PCOD? PCOD is a condition in which the ovaries contain many immature or partially mature eggs. They, eventually, turn into cysts. Junk food, being overweight, stress and hormonal disturbances give birth to this condition. Common symptoms of PCOD are irregular periods, abdominal weight gain, infertility and male pattern hair loss. The ovaries usually become enlarged in this problem and secrete large amounts of androgens that cause havoc with the woman's fertility in her body. PCOD PCOS. What is PCOS? PCOS is a metabolic disorder that is more severe than PCOD. In this condition, the ovaries produce a higher quantity of the male hormone, and this leads to the formation of more than 10 follicular cysts in the ovary every month. This stops the release of egg, leading to an ovulation. Symptoms include hair loss, obesity, and infertility. PCOD vs. PCOS. How are they different? PCOS is a serious condition. PCOD is not considered a disease, as with the correct diet and exercise schedule, the situation improves. PCOS is a metabolic disorder. PCOD is more common. Almost a third of the women around the world suffer from PCOD. PCOS has a lower number of patients. PCOS has serious complications. Women who suffer from PCOS are at risk of developing diabetes, high blood pressure, cardiac vascular issues, obesity, and even endometrial cancer. PCOS is visible early in life. Girls who suffer from PCOS show symptoms of the disease since their teenage years. Acne, excessive hair growth and weight gain are apparent from a younger age due to metabolic disturbances. While PCOD may develop later also, those with PCOD don't have significant fertility issues. With a bit of medical help, they conceive successfully. Women who suffer from PCOS, on the other hand, struggle with infertility. They even have higher rates of miscarriages. Those with PCOD can still ovulate regularly. The women who have PCOD may have similar symptoms as PCOS, but they retain the ability to ovulate periodically and thus can conceive successfully. However, those with PCOS do not ovulate due to a severe hormonal imbalance that disturbs the process of ovulation. In both cases, i.e., PCOD vs. PCOS, losing weight, eating a healthy diet that is free of processed and junk food, and following a regular exercise, the schedule has shown tremendous improvements. It is imperative to catch the disease as soon as possible to control the damage with proper lifestyle changes and medications. If you have irregular periods, acne, or excessive facial hair growth, you need to get yourself checked. Symptoms of PCOS PCOD. Apart from cysts on the ovaries, symptoms of PCOS include irregular periods. A lack of ovulation prevents the uterine lining.